So today on this episode, I'm very excited. We have Dr. Betsy Dovec and we have Hannah, and we've worked with them for quite a while. So they are Boost clients, but we knew them even before that. The most interesting thing I think they have going on right now is a pretty large expansion and a construction project. So I thought we might start with what it has been like. You'll have to remind me of the date, Dr. Dovec, but when we met in person, you were about to open your own practice from the ground up. So, yeah, I guess I would just love to hear. That's been a while ago. What has that journey been like? Let's start there.
Sure. Well, we are excited to be on your podcast, and we are also putting this on our Dr. X Dietitian podcast. So, hello to our fans as well. So, yeah, I was a hospital employed bariatric surgeon for over a decade. And in 2022, I decided to resign and I wanted to, it was kind of that like pinnacle of life. I was in my early 40s and I thought it's now or never. I've been talking about, I would do it this way if I did it myself, or I would have and build a surgery center and all these kind of hopes and dreams. And I thought you have two choices. You either just shut up and just keep doing what you're doing, which is fine, or you decide to take the leap and now is the time. So I resigned and I put in a 6-month notice. And then we ultimately opened Body by Bariatrics in April of 2023. So we have now been open for over a year and a half. And Hannah has been my ride or die employee numero uno with me from day one. We worked together previously at the hospital, and she's a registered dietitian, I guess, by trade, but she can explain to you that that is really not her main role here with this practice.
Yeah,
Hannah, yeah, tell us a little bit about that. I assume your days have not been full of doing registered dietitian work. What has it been like?
no. Oh man, and my days are everything. So some days are, yes, I do still see patients. I am still practicing as a, clinical dietitian, seeing patients pre-op, post-op, answering questions, answering texts, whatever they need as far as that goes. But I'm in Boost all day long, to say the least. I try not to be. It's really addicting sometimes. I have to stop. I have to close it sometimes because you just want to it's like texting with your friends. But then otherwise, I'm doing marketing. I'm working on the website. I am, gosh, I'm trying to think what I've done today. We just launched a new program called Project Reset. So we've been working on getting all of the kind of deliverables for that out there. So working on stuff with that, with our therapist, with our exercise person. I met with our PA today to talk about translation services. So just, anything and everything. If it's a project, I probably have my hands in it somehow. Probably the only thing besides that I don't touch really is billing. That's really the one thing that everyone else can deal with that, and
Yeah.
I'll stay away.
Okay. So currently, after you've been in business for a while, Dr. Dovec, what's your schedule look like today? What is a week?
Yeah, so we do everything. We do everything from taking out the trash, as they say in a startup, and we're still in that gritty mode, even a year and a half into it. And we are also building, like you alluded to, a new space that will be our office space, but also a surgery center. So it's big. It's just so many details and meetings and things to get that going. So a typical day, a typical week, I still operate 4 days a week. So there's a lot of operating. And then on the other day, I do a very busy clinic day to kind of feed the remainder of the days. I do bariatric surgery only as my only procedures, but I also, like Hannah said, we have medical weight loss offerings. We have a weight loss and metabolic tracking program where patients purchase a cellular scale, a smart scale that does more than just weights. It tracks many other things, metabolic health, visceral fat, lean muscle mass. And then we have something called Project Reset, like she said, which has 12 weeks of small group, kind of like therapy sessions. And they also get tailored meal plans, and they meet with me once a quarter for motivation, meals, mindset, and movement. So we have a lot of offerings. So in between everything, we're thinking about what is our social media strategy? What is our website design? What is our programmatic growth? We just we just started Project Reset. It was kind of one of my spiritual awakenings when I was on vacation. I'm like, we have to do better in the offerings that we have for patients post-op or even before surgery. We need to do better and make it truly comprehensive. So we're always thinking about that. We just hired a physician assistant who speaks Spanish. So like Hannah said, everything that we have to look at it through that lens. So we have translated so many things and we're still doing all of that. And I do actually really enjoy accounts receivable and understanding that. I'm now a basic accountant, and I'm also really understanding the things I don't like, which is understanding how to get credentialed and contracted with the payers, getting better contracts, making sure that the revenue cycle, you should get paid this. Are you getting paid that? When are you going to get paid that? And we have to have other staff members really just help us with all of this operations of this business. So there's a
Yeah.
lot of moving parts, that always doing meetings, and we have a podcast, all kinds of stuff. It's nonstop, pretty much.
Yeah, I think, in my previous life, I worked with people who were in the midst of starting their businesses. And then when we didn't come from the world of medicine, but getting into the world of medicine, became aware that a private practice physician has, I, I don't know of any other industry where they have to have their hands on so many things. And if you're big enough organization to have a full-time CEO to run the company, that's one thing. But 75% of people, 90% of people are at the level where the physician is involved in all the business decisions, strategy, execution. And the thing that's different about other industries is you would hire rock star people to deliver the product, but with what
Mm-hmm.
you do, you the two hands that you have right now are what also generate the majority of the revenue. So now, how do you decide? That you can't be touching everything. So how do you decide what to let other people handle? What's the highest best use of your time when you're not in the OR? Can you talk about that?
Yeah, so I mean it's cliched, it's absolutely the key to success is the people you surround yourself with. And I have Hannah here who has really just, I mean, I've watched her blossomed and I know that she's not even near her fullest potential yet. Like every day we're like, wow, we learned something. She's like our digital creator. She is so just creative in what she puts out there and how she leans into things. So I feel like our team really succeeds because we know that there are so many things that we don't know. You don't know what you don't know. And when we come across something, it's always like, yeah, I'll figure it out. I'll lean into it. Not like, well, let me just keep kicking this ball around. And we don't do that. So we all will take care of it. We will all help each other. Our group chat is on fire to help that. I have somebody named Joni that you've worked with, and she works so closely with your team. And I think that we talk about my own Body by Bariatrics team, but it's also an extension of you, your extended team, and it's in, I guess I would call you like the vendor or what have you, but you're just so much more than that. Your company, Boost, we are beyond thrilled with this. And it is, we call it like it's a verb, like I'm going to go boost right now. Like that means like sometimes you just need to like just get some like easy checks off your list so you'll go and have like chats with people. And for those of you listening that don't know what Boost is, it is a customer relationship management tool. So it's our way to be able to text the patients, email the patients, assign automations to different things. So if we move you into that bucket, if you will, then you will automatically receive this messaging, and your team will work with us and put our logo on it and make it the fonts that we want. And they'll also create, I think we have like 10 pipelines. I cannot imagine too many of your customers that utilize Boost to the degree in
Yeah.
which we utilize it and love it too.
Yeah. No, I think you guys are one percenters as far as taking advantage of yeah, uh,
They're like, them
Yeah.
all
again,
the all
Take
the
another
different
thing.
advantage
parts
is
pieces.
probably the right way to say it.
No, no,
I was just
sorry. Yeah,
thinking that.
take advantage of what is available, which is
Mm.
what you should do. Uh, okay, so you know, let's be brutally honest, because if someone asked me about Boost, my first response would be the fun. We've been in business 7 years, and yes, yes, yes. But if they wanted to keep talking, I would talk about, yeah. It's also been some really really challenging things. I mean,
Mm,
when you're doing something new, it you've never done it before, and it can feel like that's what we've talked about over the years is how come it sometimes feels like we're failing. It's not failure, it's
Mm-hmm.
doing something for the first time, which is,
Mm.
go ride a unicycle for the first time. It looks like failure, but it's learning. um, what would you say, yeah,
Oof.
to someone who's thinking about starting or is starting, or they're 3 months in? What do you say about, what's the honest side of, yeah, it has not been all sunshine and rainbows, and
No.
we're talking about signing things at the bank, we're talking about people's livelihoods. How do you, yeah, how do you walk through that and keep a peaceful disposition, and also just remind yourself that everything's going to be okay?
Woof. Yes. I mean, that's such a great question because this is not easy. Entrepreneurship is not easy. Owning and starting a business is not easy. I know that as a clinician, we are trained to do a very specific thing, and you think you know about, like, again, the operations of the workflows of what everybody on your team is doing, and you could do it better and you can market better, and you kind of have an idea, but there's just so many layers. Like, all right, well, where do I start? Like, okay, first you got to go on Sunbiz and get a tax ID and have a billing address, and then you have to start this whole process of, well, there was always somebody behind, like, the drape that was getting me my contracts and credentialed, and I would just show up and operate, and I was magically in network. And then there's like all these conversations you have to have. So I think the biggest advice I have is from actually a woman who also started her own business. Actually, I just got to tell a story about her. I think it's pertinent to all of us. Her name is Bethany Shank. And she, in, I believe, like the early 2000s, she had a job with Cigna, and she was really high up in this position. And ultimately, she realized that there was an inefficiency in that the way that employers would send out their benefits to their different employees was they would do it all by paper. And then it would come in this massive volume of paper, and just inefficiencies would come through Cigna. And then she would have to kind of like get them all set up. And it was just a mess. So she said this should be web based. So she created something called Web Benefits. And then she ultimately, about a decade later, sold it for over $105 million. And it was because she's like Sarah Blakely, or from anybody, that they recognize that there is a hole, a gap here, and that she's going to fill that. And she told me, and she's just a random stranger that now became my very good friend and absolute mentor. But in the early stages, she said to me two things. First was, you're not going to not do this. Like, you want it so much and you're so passionate about it, and it's not going to be easy. But the second piece of advice is you have to get organized and just realize that every day, if you do a few things, even if it's three things and maybe two of them were surgeries, that's great. But if you do a little bit every day, like you said, over the 7 years, like, look what you have accomplished and look what we have accomplished over a year and a half. Are we where we want to be volume wise, accounts receivable wise, profits wise, the contract, all these things? No, of course not. And it does feel like a failure. Sometimes you're putting things on social media every day and it's like, I got 10 unfollows. Like, I'm just tired of it. But the true thing is, it's all about grit. It's about having passion and perseverance for a long-term goal and showing up every day. Listen to Angela Duckworth's podcast on this, on her TED Talk rather. And she's going to tell you that you just got to consistently show up even when you don't want to. And that,
Yeah,
I think, is just really it. And you will succeed. You will. But
yeah.
you have to have that mindset even when days get dark. Just as long as your right-hand person isn't also dark on those same days, I think you're going to be okay.
So the two of you going through this together, does it? If I say, is there anything, if you could look back today and say, well, I would have done this very differently? Does anything pop up for that?
Um, oh boy, Hannah, what would, um,
I think some of the early credentialing stuff, like finding like all of that, looking at billing, all of that, we just went in thinking we send in the thing and somebody pays us, and like there wasn't great, structure there. So I think that's
yeah.
one of them. I think if we could go back and look at our original website, we would have cringed really hard at it. So I think if we had, had a forethought on what we wanted it to look like it was a little amateur at the beginning.
Yeah, I think I'm gonna expand on the first part about the billing aspect. That that was absolutely like number one, like almost embarrassing mistake. And you're gonna be like, that's so basic, like how did you not do this? So I got the contracts, and then you're finally in network, and then I finally start operating. And when I was hospital employed, even when I was in Maryland or in Florida, I would lock the note and it would automatically be sent out. It would bill, and then I would get paid. I mean, I got paid every 2 weeks, so it wasn't like that. And so I started in April, May, June, July. My husband, who helps with the financial aspect of it, he's like, we have gotten exactly $7.38. And I'm like, well, it takes a while for the revenue cycle to complete. I think it takes like 90 days. It's like, okay. So then we realize that there is like, you lock a note, and then it goes out to a clearinghouse. The clearinghouse determines if everything's like a clean claim, and then it goes to the individual payer, and then they have your contract, and then it gets through an electronic transfer of funds back to you. So you're like, okay, well, guess what? That stuff requires that you set it up. And that requires somebody to actually push out the claims every day. And that requires to make sure that the clearinghouse, you're like seeing if they're clean or not. And that requires for Medicare that the diagnosis codes have to be in a very specific order. And you have to have a portal for that. And you have to have access to Availity. So there's like a million things that I didn't do. And so I probably did, I'm going to say hundreds of thousands of dollars for free services in the
Oh,
beginning. And I know that that sounds like how stupid. Get your money right, right, girl?
I
But
know.
for if you are listening to this, I do think that now it's very, very simple. It is very simple. They all follow they're like, okay, I know that United does this, but you have to kind of like know their kind of nuances to be able to do
Yep. Yeah.
it.
Well, in another time, I'll share some of our silly stories that will make even that one seem not like a big one. So,
Okay, thanks.
uh, th- yeah, this is a. You guys can feel free share your case number or not. It doesn't matter. I think
Sure.
the main point is you guys do a large volume, especially in light of the staff that you have. If you compare yourself to other any surgical clinic that does that amount of cases, it's very efficient. Can you
Yes.
either or both of you can you speak to how do you have you guys kept so few people and still had a fantastic customer experience?
Well, I will go first. And, so at exactly 18 and a half, almost 19 months of being in business, we are going to hit our 1,000th case. So we will have done 1,000 cases. In the first few months, the first month, I did 7 cases. The
Wow.
next month, I did 20 cases. Now we're doing around 65 to upwards of 80 cases a month. And we are very efficient. We have, again, Joni on our team, who is kind of like the executive director of operations. She's essentially like on the track to be a COO, if you will. And she is so great at really understanding the patient flow, and everything that we do very specifically look at it through the eyes of the patient. Okay, they're like, and this is part of the secret sauce of Boost too, is that idea of the stages of change. There's pre-contemplation before you might really even be on your grid to think about bariatric surgery, or if you qualify, and maybe that's where a specialist will come in and tell you. The next phase is contemplation, and that's when people are really actively looking. And you hope that you have enough resources or a digital footprint out there that people will actually see you and find that website. Just like that we do if we're getting our hair cut or going out to eat, you really want to make sure that what is represented out there is great, which is also another amazing thing about Boost is you've really helped us to ask patients to give us Google reviews. And we have over 400 5-star Google reviews. So that's been massive too. And then they get into that preparation phase. So you really want to make sure that you have somebody that's like a navigator or an advocate that is following and watching that those who enter and actually get an initial consult will complete all of their items necessary to have their final consultation, which is when you will schedule them for surgery. So if you get them, you take care of what's on your plate, or we don't give you more in our practice. And we have people that are just excellent at just just constantly going through those patients that have their consults and getting them to surgery. After surgery, we follow them for life. We have someone who's really great at making sure that a month in advance of their 6-month, 1-year annual follow-ups, they're getting their labs checked, that we're following up with them, because that is how you keep churning it up with word of mouth. Oh, you had surgery elsewhere. Oh, wow, you really like our program because of the support that we offer. We do virtual support groups every month. We do in-person meetups. We offer things like Project Reset. We are available all the time through texting through Boost. So even on the weekends, there's one of us on there. And so
Yeah.
we just kind of know what our lanes are, I guess you could say, that we know that the expectations for the position. I will tell you, I don't tolerate mediocrity. You have to have a mindset of excellence. If you don't, you're not for this team, because I'm going to micromanage you out. I don't have time to micromanage you. Nobody wants that. But if you don't fulfill those things, then we do, all of us, we're such a small team that like you have to hold up your end. Otherwise, you're just going to leave, because you know that there's almost like this peer pressure. Like everybody's working hard. Everyone is working these hours. Everybody's seeing the bigger picture and the vision. And so that's what makes it exciting. It's tiring, but we have each other. And I think that that's why we're all very aligned in that mission.
Yep. Yeah. Well said.
Yeah, I mean, just one of the things you said, that what kind of popped into my mind when you first asked it is like having those very clear and defined roles is really what helps us to know, because it is, I think early on we were so small and not, obviously building our clientele base, we were all hands on everything. And it got to a point where we had to be like, whoa, 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 what, we had to really sit down and define, like, okay, if this, then this person takes over. And we have this crazy flow chart, and we've got this person would take on, this question, and until they move into this bucket, I can say, all right, I'm just not even going to look at that person, because so and so's got it. And so I think that early on we definitely were not that efficient, because we were all hands on every single minute task, and that didn't work out for the long run once we grew too big. So that would be kind of what I think of.
Great.
Yeah.
Fantastic. Okay. Last question, and you touched on it in what you were saying. You guys do seem to have a pretty robust social media presence, engagement, following. I know you get a lot of patient attention from that. Why is it? What's your philosophy there? How did you start with that? And why do so many private practices they're just completely non-existent in that realm? When it I know it's not free, it costs your time, but it's so much less than 10K a month in Google ads. Why are so
Mm.
many offices not able to get any traction there?
So, I mean, I put this story out there a lot, and a lot of people have heard it, but I think it's so relevant to the whole story and my mindset very early on. I finished fellowship at Vanderbilt, very prestigious, really awesome. You kind of have this thought that, again, you show up, there's patients on your schedule, and that's great. It's like, all right, I got my first big girl job. I go to Baltimore, Maryland. And whenever I showed up there, I had assumed that I would have a book of business. And they're like, absolutely not. You have no patients. And the way that we did it in 2013, when I started, was we would have to go out and do information sessions in person. And so when I started there was already a medical director. They had already had a practice. They were doing pretty well. They were doing about 200 bariatric surgeries a year, which was decent in that time for a community hospital, especially because we were very close to Johns Hopkins, University of Maryland, and some other big healthcare systems. So the director at the time, his name was Dr. Liao, and he really, he really wanted to make sure that it was done very specific to his preferences. And I'm like this very different personality, young, coming out of training, and maybe even a little immature, who knows at that time. And he said, we're going to have you do the information session. We're going to really market this thing. And so I said, okay, great. So the hospital marketing team put together a big thing, these print ad campaigns and all this stuff. And long story short, they had a room, which was standing room only. There was over 50 people in this room. And it was really like, wow, that's a huge attendance for one of these things. This is great. So he introduced me that night, and he said, this is Dr. Betsy Dovec. She is my new partner. And she's never done one of these diabetes on her own before. So I'm hoping that one of you here in this audience will be her first ever patient. And of course, everyone's like, oh, okay. And then he's like, I'm the director and blah, blah, blah. So after that session, everybody goes and they sign up on the paper. And he got 53 signups and I got 0. And I realized I was trying to be something I wasn't, and I was like, you know what? I'm going to try and just meet them where the patients are, which is on social media. So I created a virtual support group on Facebook, and the patients were already at that time on support groups, so they were already starting. It wasn't like that novel, but for a program to have one was slightly novel then. And so I started that. And at this point, we have 10,300 patients on that support group. I started in July of 2013. We have Instagram was just new and I was on there. If you look at my Instagram, I posted like over 3,000 times because I was posting like back when I think one of the early things in 2012 because I liked it myself. So I'd post, if you look at the evolution of that, it's like, oh my gosh. And then also leaned into Facebook, a little bit on TikTok, very little bit on YouTube. We keep evolving. We're doing podcasts. We're trying to look at the trends, the way that I edit the reels now. I put captions, a logo, like all the things. And it can be demoralizing because if you're now going to start this, because I have an over a decade head start on you in another private practice, it can be like, man, she has, 21,000 followers on Instagram. It's going to take me a long time to get to that. And it does. And now the way it works is you have to kind of monetize it and put money behind it. And there's just so much to it and it can be frustrating. But just like I said earlier, I do believe that if you don't exist online, you simply don't exist. You have to do it as much as you don't want to do it. Maybe hire a marketing person to do it that hopefully won't gouge you and has some results and can show you some really effective analytics that equate to actual consults that are seen. And you really have to understand that information to be able to improve upon it. And I think that you got to lean in and you got to do it, especially in private practice, because again, we're up against people who have way deeper pockets than you do. So you have to really be very effective in that.
Yeah. Yeah.
It's a
Yeah.
lot of work.
It's a hard
She does. Like she does so much of it. I will sometimes dip my toes in with the social media and everything. And I swear she's quiet when I'm not talking. And I think that it is so important because I mean, what business isn't on social media now?
Yeah.
It's where I find everything I want to buy is going to be from an ad on social media. Every piece of parenting advice I get is from somebody on social media. I mean, literally, it's everything. So I
Yeah.
think that you have to put the time into it, and it is a lot of time, and it's a lot of learning. I mean, like you said, I would love actually I want to scroll all the way back to your like
You
2012
should. Oh, it's so
Instagram.
bad. It's so
Because I
bad.
know my 2012 Instagram is terrible in the days of filters and all of that. So
Oh my God. I
I
always picked the Nashville filter because
yes.
I thought it was just so cool. I lived in Nashville and I picked the Nashville filter.
I liked whatever one was like that made you like super like intense. It was really like vibrant. But yeah, I think it's
Yeah.
just keeping up with it and staying on top of it, and like she said, like utilizing outside help because we definitely do that too.
Yeah.
So
Yeah.
Oh yeah.
Well,
Through your team. I mean, I have an idea. Like for example, this is something that was wildly successful. Was that the other day we had so every MBSA QIP, which is the bariatric accreditation, every facility has to have so many as part of one of the standards, so many support groups. So you have to have at least 6 a year. And now they went, of course, since COVID, everything goes from in person to virtual, and then you do them on Zoom. And some people feel as though like you lose that connection, and so you don't get great attendance. And it's still, again, lots of effort. You have to put it out there. You need that attendance. You need people to show up, and people do need support. So I definitely think that, I mean, support is treatment. It is part of being part of this community. And so the last time we did one, I was like, wait a second, let's try Boost for this. So we sent out an email explaining the support group. Then we sent one day before a text saying that tomorrow night at 7 p.m. Eastern, we are going live on Zoom. Here's the link. Be there, be there, be there, be there. And then at 5 till, we said, click on the link now. We're going live now, which I know that I actually stole it from you because this is what you did when you did your thing. So I'm like, wait, why don't we do that? So we did that, and we didn't realize that our Zoom account had 100 people maximum. So now Hannah is on there, like trying to like, people are now like texting us, like hundreds of texts, like, I can't get in, because we are, help me, help me. So then I'm like, take my credit card, like just go and just expand this. So she increases the amount of people on there. And then all said and done, we had 250 people on a support group. I guarantee, I would bet anything on it that that is a record. And now for the next one, we're really going to take it to the next level. We're really refining our ads, and we're running this across our social in addition to the text and the intimate nature. And we're doing it with another practice as well, and we're going who also utilize Boost. So we're like actually trying to like multiply it through their audience and our audience. And it's honestly about like the rising tide here. And I
Yeah.
think that our whole goal, everyone's goal, at least in our bariatric community, is to increase those who are seeking out the best treatment option that exists for bariatric surgery and improving access to care. And that's really why we're doing what we're doing, and hoping that people see it and they take advantage of it for
Yeah,
sure.
man. Ah, that is great. Thanks for sharing that. And yeah, I'm gonna wrap up. This seems like a great time, but yeah, it's been so fun working with you guys. You've challenged us. I think you've made us better. Hopefully that is reciprocated. But man, and thank you both for giving me at the end of your time zone, the end of your day, giving us some time. I hope we can do it again. I'll wrap this up, and then if you guys will stay on for 1 second. So
Sure.
Dr. Dovec, Hannah, thank you guys so much, and we'll do it again soon.
Yes, this was so great. Thank you for having us.
Yes, thanks again, Maddie. We absolutely love Boost. And if you're on the fence about doing Boost, whatever your specialty is, we are expanding to plastic surgery as well. And so Boost is going to be our go to. I'm going to tell you what it is. They are the most responsive, efficient, kind, fun, attention to detail. We honestly would not be where we are success wise in terms of cases if it wasn't for that conversation I had with you in Amarillo, Texas, Maddie, in that rogue kind of like rent your space conference room. And it's a tough concept, I think, to get initially, but those of us who I hope are somewhat early adopters of it, man, we have massively benefited from you and what you've done. So seriously, we love it. Thank you so very much, so much.
Just so appreciate that. I'll take that plug all day. All right. Thanks, guys.
See you soon.